Vigantol is a vitamin preparation affecting the exchange of calcium and phosphorus. Indications for use. According to the Vigantol instructions, this vitamin remedy is intended for the treatment and prevention of rickets in children, preventing the development of the deficiency states caused by a lack of the vitamin in patients belonging to the high-risk group. People with biliary cirrhosis, malabsorption, chronic bowel disease, especially the small division, and also after resection of the small intestine and/or stomach. Treatment of hypoparathyroidism, diseases of the endocrine system resulting from parathyroid hormone deficiency, and pseudo-hypoparathyroidism, hereditary osteodystrophy due to the resistance of peripheral tissues to parathyroid hormone, accompanied by disorder of calcium-phosphorus metabolism, maintenance therapy for osteoporosis. Treatment of osteomalacia resulting from disorders of mineral metabolism in people over the age of 45 years due to prolonged immobilization. Adherence to dietary nutrition, especially with the rejection of milk and dietary products. How to use. The specific dosage of the drug depends on the evidence and the age of the patient. For the prevention of rickets, healthy full-term babies, Vigantol is recommended to give 1 drop daily from the second week of life. In this case, the drug is indicated for use before the child reaches 2 years of age, or at least in the winter months, because it is during this period that there is very little sun, which contributes to the production of this vitamin by the body. For the purpose of treating rickets, Vigantol is prescribed in an amount of 2 to 8 drops once a day. The duration of treatment is usually 12 months. For the prevention of diseases caused by a lack of vitamin D3, you should take 1 to 2 drops once a day. When malabsorption, Vigantol prescribed to prevent the development of vitamin D3 deficiency, standard dosage 5 to 8 drops per day. For maintenance therapy of osteoporosis, take 2 to 5 drops once a day. When osteomalacia caused by a lack of D3, Vigantol is shown in the amount of 2 to 8 drops. It should be taken once a day for 1 year. In hypoparathyroidism and pseudohypoparathyroidism, its required dose of the drug is determined taking into account the plasma concentration of calcium. The average daily dosage may vary from 15 to 30 drops. In the first 4 to 6 weeks, should constantly monitor the concentration of calcium in the blood. If necessary, adjust the dose of Vigantol. Further analysis is carried out once in 3 to 6 months, and also if required, increase or decrease the dosage. Contraindications. The use of Vigantol according to the instructions is contraindicated in hypercalciuria, hypercalcemia, hypervitaminosis D, calcium nephroureourephysis, renal osteodystomy accompanied by hyperphosphatemia, stereotoxicosis, the presence of hypersensitivity to the drug. Assign Vigantol, but with extreme caution, carefully assessing the expected benefits and potential risk with heart failure, organic heart disease, atherosclerosis, sarcoidosis and other granulomatosis, acute and chronic kidney, liver diseases, renal failure, hyperphosphatemia, hypothyroidism, phosphate nephroureourethritis including a history, diseases of the digestive tract including peptic ulcer and valve duodenal ulcers, taking vitamin D3 including as part of other drugs, pregnancy, breastfeeding, simultaneous use of cardiac glycosides, antacids, benzodiazepines, thiazide diuretics, sodium fluoride, phosphorus-containing drugs. Special instructions. If necessary, taking the drug during pregnancy requires careful selection of the dose. This is due to the fact that overdose may develop hypercalcemia and transplacental penetration of vitamin D3 metabolites in the fetus, and this can lead to a delay in physical and mental development, special forms of aortic stenosis. In addition, it is important to bear in mind that vitamin D3 and its metabolites are excreted in the mother's milk, therefore caution is also needed when using Vigantol during lactation. Side effects. If the recommended dosing regimen is observed, the vitamin preparation is generally well tolerated. In some cases, the use of Vigantol arises. Nausea, flatulence, constipation or diarrhea, abdominal pain, loss of appetite, side effects of the digestive system, myalgia and arthralgia, reactions of the musculoskeletal system, arrhythmia, increased blood pressure, adverse effects of the cardiovascular system, urticaria, rash, itching, allergic reactions, headache, functional renal impairment, exacerbation of the tuberculosis process in the lungs, other side effects of the drug. When using Vigantol for a long period of time, there is a risk of developing hypercalciuria and hypercalcemia.